Breast cancer is a disease not only prevalent in humans, but also with our feline friends. In fact, 85% of mammary tumors in cats are malignant, and they tend to grow and metastasize quickly. On this episode of the Paw Report, we're joined by Dr. Sally Foote of the Okaw Veterinary Clinic. Dr. Foote will talk about the symptoms, diagnosis, and treatment of breast cancer in our four-legged friends. Stay with us. Production of the Paw Report is brought to you by
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sales Street in downtown Tuscola. More information available at okawvetclinic.com.
Thanks for joining us for this episode of the Paw Report. We're joined by Dr. Sally Foote, and our very good friend Ranger has decided to be with us for this episode as well. And we're talking about, a rather serious topic today, feline breast cancer. And I suppose I'll start with cancer is just not a human disease.
Oh, correct. Yes, we see cancer and types of cancers in all species: dog, cat, horse, livestock. All species.
Do you see a lot of cases come through your office?
We do see cancers in pets, dog and cat. It tends to be a problem more in the older pets. So, in the case of, say, a dog over, say, the age of 7, certain breeds have more problems with cancers as compared to others. And in cats, when we do see cancers in the cats, they usually are in cats usually over the age of, say, 10, a little bit older than dogs. Now, in the case of cats, there is a problem if the cat has the feline leukemia virus. They can get infected at a very young age with that. There are cancers associated with that virus that can show up at a much younger age because they have that virus.
How prevalent is it in felines?
We are seeing, first of all, cats are, it's kind of a hard question to answer because, yes, more households have pet cats than pet dogs, and cats are living older than, say, 15 years ago, yet few people bring their cats to the vet because the cats don't like going to the vet. So we may not be able to see or pick up on these problems until either they're well advanced or maybe the cat may have passed or something like that. So it's a little hard for me. We are seeing more of it as pets are aging, but it's a little bit of a harder to really answer that question as well as I would like to answer it.
Well, and I totally understand. There are different types of feline cancers. Can you go through the different types that you may see?
Right. So cancers can occur in any organ system. You could have a cancer in the eye. You can have a cancer in the mouth, the skin. Breast cancer was one thing that we're going to talk a little bit about, or the intestinal tract. Of some of the more common cancers we would see in the cat, especially in our really geriatric older cats, is a type of intestinal cancer called lymphosarcoma or lymphoma or adenoma. We can see types of tumors in the mouth, like one's called a squamous cell carcinoma, and that actually can be associated if there's smoking in the house, cigarette smoking in the house. As well as then, in this case, we're talking about breast cancer, say is another one we can also see.
What do we know about the cause, particularly in felines?
There's a few cancers that we know there is a cause for or risk factor. So I mentioned the feline leukemia virus. So any cat that a person has, when you first get that cat and at different times in their life, it's good to do a blood test and make sure that to know whether or not they carry that virus or not, because that can increase possibly a risk for some cancers. Then things like sometimes some cats can get a type of a skin tumor related to injections. So this is why a checkup every year is important. Even if they're not getting shots, it's really important to check their weight, check their body over, look in their mouth, etc. Like I said about the squamous cell carcinoma in the mouth that can also sometimes occur on the ears or the nose. An increase of a risk factor for that would be if there's secondhand smoke, cigarette smoking in the household. So get the cigarette smoking out of the house if you can't quit, you know. And I've seen people quit for the sake of their pets. Well, yay, everybody wins on that one. But that can be a possibility of a problem there too.
Let's talk about some symptoms that your pet may experience, given all the different types of cancers that you mentioned. What are some symptoms, and how will those symptoms affect my pet?
The symptoms, first of all, might be related to what part of the body is affected. So, for example, if they may have, say, a tumor in the mouth, you may notice that their breath is smelling more foul than maybe it normally does. That they're avoiding, say, eating dry food because it might hurt to crunch down on it. That they might be pawing at their mouth, or you notice some staining, say, of saliva because there's a little bit of drool there. And pets are not going to cry. They're not going to moan. They're not going to be like holding, oh, my mouth hurts like this,
right,
until they're way super painful. So they're not going to show those signs early on when the problem is already starting. So weight loss is very common. As any kind of cancer advances, that say maybe involving the intestines, especially the kidney, the liver, or a main internal organ tissue, you'll start to see them losing weight, which can be hard to judge. But the first thing to do is pet your cat, and what you really want to say is he feeling a little more bony? Am I feeling like his hips where I normally didn't feel it?
Ribs? I mean,
ribs take a long time to show. They've got to lose a lot of weight to get that skinny. Mm-hmm. So what I tell clients is his backbone, you can feel a little bit more, can't you? Yeah, I noticed that. Okay, he's lost weight. He's lost like 10 or 20% of his body weight. But because he's small and they tend to carry it like in the abdomen and around the trunk, that's why seeing the ribs is like when they really have lost a lot of weight. So again, those regular checkups where the weight is getting checked, the mouth is getting examined, the body's getting felt over. I love people who pet their pets a lot because they find the problems early. They come in and like, look, there's a lump here, and it might take 5 minutes in the office. I found it the other day, Oh, here it is. And like, yay, you found it. Okay, let's get a marker and circle that so we don't lose it. Mm-hmm. And maybe we'll just take it off the skin and send it in for biopsy to know, but yay, we found it when it's little. And even if it comes back something kind of bad, then we may be able to do treatment, or because it was contained to this area, even though it might have been like a mast cell tumor, say that's one type that can spread to the body and be bad, but it's contained here. We got it all out. Maybe we only have to do a short time of medication to prevent it from spreading elsewhere, then waiting until like, oh wow, we got this big lump here, and now the pet's losing weight and such.
Well, that kind of led into my next question about how do you diagnose a pet that might have cancer, and what can I do at home? And you said just self-check.
Yes,
pet a lot.
Pet your pets, give them baths, whatever.
and in your office, if somebody brings something in, is it through a series of blood tests?
Yeah, usually we're going to do, besides the physical examination, we would usually do some kind of general screening blood test, and based on that then, if there's any specific, say, blood test that can be run, we'll do that. Oftentimes, say, x-raying the chest, we do look for metastasis if we suspect disease, or if we took that lump off and we got a diagnosis, of a type of cancer, then we stage it. And we take, say, chest x-ray, or we may do other blood work, or even an abdominal ultrasound to see if there's spread, and then know what stage is it at, and then based on that, what are our options for treatment, or what's called palliative care, even like holding this cancer at bay. If we can't eliminate it, can we do things that will help to stop it from progressing? And we would have then that discussion about the pros and cons of, say, chemotherapy or not, or other supportive care, et cetera.
Let's expand on the treatment.
Mm-hmm.
One of the first things we talked about is humans and our animals do share a common bond in cancer, that we both get them. So is chemotherapy, is radiation one of the treatments that a pet owner would consider?
Yes, they are. We're very lucky in this area here that the University of Illinois has an oncology department, and meaning they have veterinarians who are specialized in the treatment of cancer for all animals. Mm-hmm. And so they do offer radiation treatment for the types of tumors that's appropriate for. They do offer chemotherapy or setting up the types. Sometimes chemotherapy is all just oral medication, tablets and such. Sometimes it might involve IV treatment. There may be other things like more advanced surgery that is needed. So they can consult on that, they can do that, they can even work together with the general veterinarian, say on getting them started, and the primary care veterinarian may monitor and then just go to the U of I as needed. And what's really valuable about, I think, talking to the oncologist or having that consultation is really just having that discussion about quality of life for your pet with taking these medications and things. What is the success rate, you know, of either eliminating the cancer or preventing it from spreading? You know, having that conversation and getting that information and knowledge, because this is an area that is expanding and growing because our pets are getting older, we are seeing more cancers, and we have people who are, frankly, just much more bonded to their pets and willing to consider these options for treatment.
Radiation and chemo, are they really the only two treatment options?
No, sometimes there might be things that are surgical. There are some kinds of cancers that there are actually vaccination for to help stop or to help hold at bay, if you will. And there are a couple of, just maybe 2 or 3, but there are a couple of medications that can help stop the progression of a cancer that can be a very good alternative to going on, say, with chemotherapy, because the trade-off is the chemotherapy is going to also affect them. The dosages we use in animals are lower than as compared to people, or we're not trying to always push the animal to total cure, because the amount of drug you have to take can make them really ill, just like with people. But say if you or I had breast cancer and they said, hey, you know, go through those 6 weeks of chemo and then go through your whatever 6 or 8 weeks of radiation and we can get you cleared of this, you could have another 30 years of life ahead of you, right? Well, if my dog has this and we go through, say, all that, he might have 1 or 2 years just because their lifespan's shorter. So it may be more of an option sometimes in veterinary medicine that we've done a surgery and we do some chemo and we do some radiation to minimize it and, like, as I say, kind of put the lid on it and help relieve pain or suffering from that, but it's at lower doses, so we're not getting into as many of the side effects of, like, you know, lack of appetite and things like that.
And we'll talk about side effects here in just a bit. What is the survival rate? Do you feel comfortable talking?
It depends on the type of tumor. It really depends on the type of tumor. And secondly, it also depends on how the rest of the body health is of that pet at the time we found this tumor, we took it off, and we've got the diagnosis. So again, early detection. I mean, I have had pets who've totally beat the odds. You know, I've had some pets where they had a type of a tumor, took it off, cat the report back, it's aggressive, it's nasty, it's bad, you need to do this big, huge other surgery, like take off half the jaw, etc. And the client said, I'm not doing that. I'm like, okay. Let's talk about keeping them on a good diet. Let's just talk about keeping them healthy. And maybe using, there are some supplements that are used, actually some of these mushrooms, you know, like the shiitake mushroom type supplements, like I said, that can help just sort of hold the lid on that, you know. And I have seen some pets, because we're supporting the rest of the body, and the rest of the body is kind of in this race with the cancer. So if the rest of the body is staying strong, it's helping to prevent that cancer from overtaking it. I've seen some pets go like a year and a half where the oncologist said, hey, you'd be lucky if you get 6 months before they're really suffering from this tumor. Not all the time, but sometimes you can. So I think, again, going back to early diagnosis, please don't be afraid. I think that's the one thing, is a lot of times people are afraid of what they're going to hear from me. If they feel this lump or like, oh, he's old, it must be cancer, she's just going to tell me I have to put him down.
I've been there.
Yeah.
I know. It's scary.
Exactly. And I understand where they're coming from, because 10 years ago, 15 years ago, yes, that would have been all we could have told them, because we didn't have as many choices. And so if your pet's 15 years old, the last pet you had was 15 years ago, and that's what you heard, so you don't know the difference. But there is a difference, and especially too in a lot more advances in pet palliative care means we're going to keep you comfortable with what you've got, okay? We're not driving and pushing to cure, and we are going to be we're going to have very open and honest discussions about quality of life and how to check that and assess that as our pet is getting older. It's like pet hospice, and we vets have always done it. We just never had a title for it, really. But there's a lot more that can help support your pet and help reduce or prevent pain so they can still have good quality days in the face of some of these things. And so please ask your veterinarian about that. And if they're not real comfortable working this way, there are other veterinarians who are, that actually almost kind of specialize in this too.
How can you nurse your pet? We talked about side effects, and there will be, most generally, with the medicine that they're on. So side effects, and how can we as pet owners make sure that our pets are comfortable at home going through this?
I always like to say to my clients, think of the 5 things your pet loves to do, and that's going to be your measure of how good is today. So first of all, you really need to know your pet on what makes a good day for your pet versus a mediocre day or a bad day. All right? Secondly, so we want to keep those days good, and we want to think about what would help my pet say to eat. If I had to take a bunch of mouth tumor, a bunch of stuff out of the mouth, and he may not have pain, I'm going to say to my client, I want him to eat, say, here's the canned food, but put it in a blender, and I want you to blenderize that. So it's like baby food consistency, so we can lap it up easier. Now, you might not have thought of that because you might not have thought of even like canned food being kind of chunky to take in your mouth, and if it was a little hard in your mouth, but blenderizing it may be all that they need, and they'll lap it up, and then they'll be able to eat and keep their hydration up and keep their nutrition up and stay feeling good. This is when things like a little bit of junk food might be okay.
Ice cream.
Yes, exactly. I mean, we're pretty open about saying, okay, look, if you have to top dress it with some chopped chicken, that's all right. If we have to put barbecue sauce on it so he'll eat it, that's okay. Pop it in the microwave. Anything that comes out of the microwave they usually think is your food, that might be all it takes to get him to want to eat it. If Ranger, to help him eat, had to sit in my lap, just that comfort of sitting in my lap and me petting him would help him want to lick his food, that's what you do. Okay, you're not babying them and coddling them. That's just an extra comfort step, like you said. Making sure like that if they normally laid, jumped up on a bed here, but they might, they've lost some weight, so they aren't as strong enough to get up here. Well, how about we just put the bed here, keep it in the same area, but let's make the bed for them and make it comfy for them. It's like try to look through life through your pet's eyes, and get creative. You can get very creative.
You can. Can you prevent feline cancer? Or is there anything that pet owners can do to minimize their animal getting the disease?
There are some that we can. Like we talked a little bit before about some risk factors. So first of all, if your cat does not have feline leukemia, and then there's another virus too, feline AIDS, and you're going to, let's say, allow your cat to roam outside some, get them vaccinated. That will protect them from, say, those related cancers. Early neutering, especially for breast cancer in the cat, is essential. Female cats that are neutered by certainly 6 months of age or a year of age, we rarely, if ever, see any kind of breast cancer in them. When the female cat has not been spayed, say for a couple years, and she's had a few litters, now her risk of cancer is much higher, and breast cancer in the cat is very aggressive. It's always very aggressive. We do see it in the dog too, but there can be non-aggressive and aggressive states in the dog. I talked about smoking in the home. Don't. Flat out don't. Yes, inhaling those kind of toxins. We don't really have much data on other toxins in the home that they can inhale, possibly causing other cancers in that specifically. And then the last thing is take your pet in for yearly checkups. Don't skimp on that. They're aging 7 years. Ranger's gaining 7 years for every year on this planet. We're probably, yes, we're close in our age now, Ranger. He's about 8.
About him, so
That would put him about 56, and I just turned 55 last week.
Well, that's true. That's true. Are certain breeds of cats more prone, or is it just
somewhat, and it's not as the cat in specific cancers, increasing risk because of breed is not as much that we see as compared to dogs. In the dog, golden retrievers, we see a lot of cancers at a young age in our golden retrievers now, and there actually is a golden retriever longevity study being done. One of my practices signed up for this program, and boxers are another breed of dog that we tend to see a lot of, say, skin tumors and specific tumors in at a much higher rate as compared to other breeds of dogs. And frankly, right now, I cannot think in my head of specific tumors to specific breeds of cats. We don't have as many breeds of cats as compared to dogs, and so therefore we don't have quite as much of the, really focused or inbreeding that we see as compared with some of the, canine breeds we've seen.
So the magic question is, how do I know that my pet is cured?
Well, on a lot of these, we monitor them. So we would say re-examine every 3 months, every 6 months physically. We may repeat blood work or repeat, say, if it was a mass, say, on the liver, a tumor on the liver, we might say re-x-ray the abdomen to see is there any evidence of regrowth. And MRIs can be done. That has to be done like at the University of Illinois. They do offer that there. But pretty much like how they check a person. We check the pets the same way too. And remission depends on the type of tumor, but we pretty much consider, like, if our pets are cancer-free after 1 year to 2 years, that they are cured. Would they give us 5 years? They say you got to be in remission 5 before we say you're done. But for most of our cancers, we look at 1 year to 2 years, depending on the type of tumor.
This may sound silly, but we'll kind of wrap up our discussion with this. Is there any problem with other pets in the house? Let's say Ranger has cancer and is going through treatment. Is there any chance for a risk of another pet in the household getting it, or a family member being exposed to something?
About the only one that could be possibly, transferable. There is one, those related to feline leukemia virus. And Ranger, you want to go wandering off the set, because that is a virus that is contagious amongst cats. Feline leukemia virus, feline AIDS virus, those could be. There is a type of a tumor of the urogenital tract in dogs that can sometimes be transmittable and shared if they're mating at all, or have contact in any way like that. There aren't many, there are a few. And I think the most important thing is that we have all our pets checked regularly, and then we also make sure that we are talking to our veterinarians about exactly how, like, where we take our pets, how we live with our pets, and that sort of thing, because then that helps us to know if there's other risk factors or things like that.
I think it's a great way to wrap up our discussion today, is to get your pets checked.
Yeah.
And you said it very early on in our discussion, is have your cats checked too. Because
Definitely.
a lot of people don't think
They
to do
don't.
that.
I will see cats that haven't been to the vet in 15 years.
You are kidding.
No, because they were house cats, and what's his risk of getting, any disease? That's not any. And he's acting and being fine, so there's not a problem. So they're thinking just more in terms of problem-driven than preventative.
Problem.
Please don't.
Dr. Foote, thank you so much for joining us today. And Ranger, you've been great. Even took a little nap. I guess we were boring you throughout this discussion, but we're glad that you were here today. Thanks for joining us.
Oh, thank you very much. It's always a pleasure to come.
If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too. Have a video or photo of your pet doing something funny or absolutely adorable? We'd love to share it with our viewers here at the Paw Report. Email it to weiu@weiu.net and you could see it on our show. Just make sure it's video taken by you or that you have permission to share it. For more information about how to get that video or photo to us, email or call us at 217-581-5956. Did you know full episodes of the Paw Report are on YouTube? They can be accessed at youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see. More information about the show is also available 24/7 on our website at WEIU.net under the Television tab. Production of the Paw Report is brought to you by
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.